It was popular for several decades up till 1980s. In the 1980s, something now happened in 1984 in the US. And what happened in 1984 now made room for reforms to the work hours that were being done by medical residents. And what happened in 1984? It was the unfortunate death of Libby Zion. Libby Zion. Libby Zion, she was an 18-year-old freshman in a college. The parents live in New York. And so she was back from college and was doing a kind of work, academic activity. Then she became ill. She became sick. And when she was sick, the parents, the father took her to New York Hospital, which is now known as the New York Presbyterian Hospital, on March 4th, 1984. When she got to that emergency room, she had fever of 103 Fahrenheit or 39.4 degrees Celsius. She had agitation and she has flu-like symptoms as though she has the flu. Interestingly, she also had been having mental health challenges, and so her psychiatrist had placed her on phenazine, a monoamine oxidase inhibitor, which is a type of antidepressants that was commonly in use at the time. So she was on phenazine. Now, when she was admitted in the emergency room, she was attended to by a first-year resident who was also called a term that also used for interns, Dr. Louis Weinstein, and a second-year resident, junior resident, Dr. Greg Stone. They are the ones that were in charge of her case. Now, these residents, Louis Weinstein and Greg Stone, they had so many patients to cover. Louis Weinstein was said to have about 40 patients. She was meant to take care of about 40 patients in different floors of the hospital. Now, the attending physician or the consultant physician, the specialist physician in charge, was Dr. Raymond Sherman. Dr. Raymond Sherman is the consultant physician in charge, but he wasn't physically present in the hospital at the time. He was attending physician at New York Hospital and he was clinical professor of medicine at Cornell University Medical College, which was affiliated with the hospital. He was also the family, the Zion family, that the family of Libby Zion. The Zion family, and Raymond Sherman was the family's personal physician. And when he was told about Libby's condition, it was Raymond Sherman, Dr. Raymond Sherman, who advised them to take Libby to the New York Hospital emergency room. However, he wasn't there and the patient was left in the hands of Dr. Louis Weinstein, a first-year resident, and Dr. Greg Stone, a junior resident. Now, after reviewing the patient, Dr. Greg and Dr. Louis, they called Dr. Raymond Sherman and told him about the condition of Libby. And they sought his advice. They reviewed the plan of what they had in mind to do with Dr. Raymond Sherman. But Dr. Raymond Sherman wasn't physically present to examine Libby. Now, Libby was diagnosed with probable viral infection and was admitted for observation and hydration. Because Libby was agitated, She had fever, flu-like symptoms, and she was agitated. They now prescribed petidine or meperidine. The trade name was Demerol. They prescribed is a synthetic opioid pain medication, which was prescribed to Libby because of the agitation. They wanted to give her something to calm her down. You know. Now, why doing that? They did not take into cognizance. They did not factor in the fact that Libby is taking phenazine, an antidepressant, when they gave Libby petidine. Now, that petidine, the pain medication they prescribed for Libby, petidine is broken down by the liver into non-meperidine, which has neurotoxicity side effect, and is said to be serotonergic. It has serotonergic side effect, serotonergic effects. It increases the level of serotonin, which is a neurotransmitter in the body. And the drug that Libby was already on, phenazine, is a monoamine oxidase inhibitor. Monoamine oxidase is an enzyme that breaks down several neurotransmitters in the body. We have the monoamine oxidase A, which metabolizes serotonin, norepinephrine, and tyramine. Monoamine oxidase B, A metabolizes serotonin, norepinephrine, and tyramine. B metabolizes phenylethylene and dopamine. Now, these neurotransmitters have different functions in the body. Now, the phenazine is a non-selective monoamine oxidase inhibitor, and so it increases the level of serotonin and other neurotransmitters in the body. Serotonin is said to affect the mood, appetite, social behavior, and sleep. So now, Libby was now under two drugs which increases the level of serotonin in the body. The antidepressants she was on before, phenazine, and the new pain medication she was prescribed, which was petidine. So this overabundance of serotonin in the central and peripheral nervous system leads to what is now known as serotonin syndrome. At the time, serotonin syndrome was not really well known. And at the time, the interaction between the petidine and phenazine was not really appreciated at the time. Serotonin, as I've said, regulates mood, sleep, appetite, and other functions. But when it's excessive, it can lead to a wide range of symptoms, which forms the serotonin syndrome. This can happen when patient takes more than one serotonergic drug, or patient takes an overdose of one drug. And the number of those drugs that can cause serotonin to increase, we have the selective serotonin reuptake inhibitors like fluoxetine, sertraline, monoamine oxidase inhibitors, opioids like petidine, tramadol, triptans like somatriptan used for migraines, and drugs like cocaine. This was important because later some of the autopsies said traces of cocaine was found in Libby's body, but other investigations showed that cocaine was absent. So Libby was at risk of serotonin syndrome, and serotonin syndrome has a triad, 3 sets of symptoms. We have mental status changes, where the patient will be agitated, anxious, and restless, confusion, delirium, hallucinations. It can, in severe cases, lead to coma or seizures. It can lead to autonomic dysfunction, where the patient have hyperthermia. Temperature can go as high as 104 degrees Fahrenheit or 40 degrees Celsius. Can have rapid heart rate, which is tachycardia, hypertension or hypotension, sweating, flushing. Then it can also show with neuromuscular abnormalities like tremors, muscle twitching, hyperreflexia, clonus, muscle rigidity, seizures in severe cases. Now, in severe cases, this serotonin syndrome can easily lead to death within hours if it's not treated due to hyperthermia, seizures, and multi-organ failure. So what happens in Libby's case? When Libby that was already on phenazine, when she was prescribed petidine, her condition deteriorated. She became agitated. The fever got worse, increased to 107 degrees Fahrenheit or 41.7 degrees Celsius. The nurse that checked it quickly paged the residents, Louis, Weinstein, Dr. Louis Weinstein. Over the phone, she didn't go to physically review Libby. Remember, she had 40 patients to take care of, so her hands, she was overstretched, and she has worked for long hours. So she ordered that Libby became more restless, became more aggressive, and tried to pull off the IV line that she had. And so they felt that she was going to endanger herself. And so Dr. Louis Weinstein made the decision that the patient should be restrained, that they should, put something to restrain the hands and the legs. And while she was resisting restraints, she ordered that she be given haloperidol. With the haloperidol, Libby was able to sleep. But the catastrophe, which was the serotonin syndrome, had already set in, was in progress. The following day, Libby was taken to the hospital like 10 p.m. Following day, around 6 in the morning, she suffered cardiac arrests. And even with efforts to resuscitate her, she died 8 hours after admission. Official cause of death was cardiac arrest due to an inflammatory condition. A number of things became at play. The supervising consultant, the specialist consultant, what do you call them now? The person in charge, Dr. Raymond Sherman, was not present. The attending physician was not physically present. He was the one that said, take him to New York Hospital. In the hospital where he works, but he was not physically present. As Libby's condition worsened, he did not come and review. As her condition worsened, the residents that made the decision were junior resident, first year, second year, that made the decision. They spoke by phone to Dr. Sherman, who gave a go-ahead. Now, when Libby's condition was worsening, because those residents had a lot of patients, they couldn't be physically present. Libby gave instructions over the phone, while Greg had gone to another building to sleep, And so they had been working for about 36 hours or more. And as such, it was said there was talk of resident fatigue. The medical residents were fatigued and that they had limited supervision. Libby's father wrote, "You don't need a kindergarten to know that a resident working on a 36-hour shift is in no condition to make any kind of judgment call. Forget about life and death." Libby's father, Sidney Zion, was with Libby in the hospital when all this went down. He was there. He was there when Libby was reviewed. He was there when they prescribed petidine. And as her condition got worse, the father kept asking questions. What is going on? You gave medication. My daughter is not improving. He kept questioning what the medical staff were doing and that the daughter was not improving. And his pleas and entreaties went unheeded. Then Libby died. Sidney Zion is a lawyer. A lawyer, was a former federal prosecutor, so he knows the law. So he feels there's medical malpractice here. Then he's also a writer and a journalist, and he works with the New York Times and other publications. So he was a journalist, he was a media personality, he knows the media. And so the father launched a public campaign to hold the hospital accountable and to expose the systemic issues in medical training. He argued that the doctor's death was caused by overworked, sleep-deprived residents, filed a malpractice lawsuit against the New York hospital alleging negligence due to residents' fatigue and errors in care. Eventually, the malpractice lawsuit went to trial in 1994. The hospital and physicians were found partially liable, 50%. They found partially liable for Libby's death due to fatigue and lack of supervision. The other 50%, they blamed, 50% was blamed to Libby's pre-existing condition and drug use. That is 50-50. The doctors contributed, the health system contributed, then Libby's pre-existing condition also contributed. The Zion's family was awarded $375,000 in damages. Now, Sidney Zion took on this case. Sidney Zion, the father of Libby, wanted criminal charges against the doctors. He advocated for criminal charges. The case was taken to the grand jury. The grand jury that would decide whether this case will go forward or not. The grand jury looked at it and said that there's no criminal offense. There was no intent. It was a genuine error, And as such, criminal charges did not proceed. So the father later took on civil lawsuit against the hospital, which eventually led to hospital was held partially liable. This case became very popular. The father, a journalist, a media personality, went on a campaign. There was media coverage, and all that. So due to the public outcry and media coverage, the New York State Health Commissioner, David Axelrod, he now formed the Bell Commission in 1986 that was chaired by Dr. Bertrand Bell. Dr. Bertrand Bell was someone who had been talking about residents' work hours. He has been advocating that they should review resident work hours, that residents were working for too long and all of that. And he has been working on that. So Dr. Bertrand Bell was now appointed to head the commission, the Bell Commission, from that 1986, 1987. And they found excessive long hours shifts with minimal rest, and that could lead to errors. They found inadequate supervision of resident doctors and systemic reliance, if you like, over-reliance on residents as primary care givers. The recommendation of the Bell Commission was adopted in 1989 by New York State. They implemented first regulations on resident work hours, known as the Libby-Zion Law, or the New York State Health Code Section 405. So, the New York State Health Code Section 405, which is the Libby-Zion Law, limited residents to an 80-hour work week, averaged over 4 weeks. No more than 24 consecutive hours on duty, at least 8 hours of rest between shifts, and one 24-hour period off per week, and mandated that attending physicians should have increased supervision and should be present to give supervision to the medical residents. So this was adopted by New York State in 1989. Then later in 2003, The Accreditation Council for Graduate Medical Education in the US now adopted this uh, these recommendations nationwide in the US, and they capped resident work week at 80 hours and limited continuous shift to 24 to 30 hours with some exceptions. So what was the outcome? You know, studies show that resident doctors working for long hours led to medical errors. There were more medical errors if the doctors are fatigued and overworked. So studies show that. And when this reduction in work hours was implemented, there was reduced medical errors. However, it was shown that studies showed mixed results. There was no improvement on patient outcome. Yes, while the errors that were made by doctors reduced if they had more time to rest and instead of doing very long shifts, they found that there was no more change in patient outcome. Patient outcome, whether the patient improves, whether the patient does well to the point of discharge. Then there was the issue of increased handoff. So instead of if you're doing it 36 hours, right? If you admit a patient, you'll be there to see that patient all through that day on to the following day. You understand? Then in this case of 72 hours, even longer than that. But if you now cap it at, it must not be more than 24 hours. So after 24 hours, you must hand over to another team. So you can have a case that maybe a case comes late that day. So you will not have enough time to experience how the patient will respond to the care before you now hand over. And so there will be more handovers. And when you now hand over, the team that are taking over, who were not there at the time the patient was admitted, it's possible that they will not really appreciate what's really going on compared to those that admitted the patient. So there was the issue that when you do too many handovers, as in if you shorten the work hours shift and you now have to hand over to another team of doctors, that there's the risk of poorer care for the patient and stuff like that. So increased handoff can be a problem, but it reduces medical errors and it has mixed result on patient outcome. No effect on patient outcome.